And now moving on to Nigel Carter. The Oral Health Foundation is a global organization. What initiatives are you working on from a national and a global standpoint? And how will these help to improve children's oral health, Nigel?
Well, we're working on a number of initiatives. I think many people listening will be aware of our National Smile Month, which has been running in the UK now for some 43, 44 years. We're looking at ways that we can extend that on an international basis. With Mouth Cancer Action Month, not particularly applicable to children, but we're actually entering into an arrangement where that's going to be spread across Europe. So our international activity is increasing, and we've had a lot of work around COVID return to practice in terms of some nice graphic guidelines that we've adapted from the French Dental Association, who are widely distributing worldwide. They're being taken up in the States as well. Clearly, one of the things that we're very keen on, and I'm delighted that Paul is confirming the fact that there is at last real interest in water fluoridation. And this, I think, is going to be one of the single things that can most transform child oral health. I had the good fortune to work through my practicing life in Birmingham. And one of my first practices was on the borders of Birmingham, which was then fluoridated, and Sandwell, which wasn't. And we could literally tell when children came in, and fluoride was in toothpaste at the time, so this was an additive effect. When children came in through the door and we looked at their oral health, we charted them, the ones with cavities invariably came from Sandwell, and the ones who hadn't got cavities came from Birmingham. If we had a child turn the card over, saw it was a Birmingham child, and they were experiencing decay, the question to the mother was, oh, it's very strange, little Johnny's got decay and you live in Birmingham. The 100% answer was, oh, we've only just moved into the area. So it really is going to be a huge step forwards and a huge health benefit to look at fluoridation. And that's a campaign that we're increasingly going to be supporting and promoting.
Yeah. Thank you, Nigel. What surveys are being undertaken to look at the impact of COVID-19 on children's oral health specifically?
I haven't seen specifically looking at children's oral health. I mean, it's going to be more of a problem with children than it has been with adults. Because the rate of progression of decay is so much quicker in a child population. So with adults really not being able to attend for routine examination and the odd filling or replacement of fillings over a 3-4 month period and reduced levels of access to dental care is not going to be as key as it is with children. So I think as dental practices return to normal practice, there is going to be a need to prioritise children. They're clearly going to be under pressure from everybody to see them, but children are going to need to be prioritised, because if they are left for longer, the consequences are going to be larger for that child population than for the adult population.
No, absolutely. And it's got to be a focus, hasn't it? And now, in regards to the Oral Health Foundation's accreditation program, it's widely regarded globally, Nigel. Can you explain why this validation is so important for dental products, and what does it demonstrate to consumers?
It's very much, from our point of view, it's a consumer-focused campaign, and it is to protect the consumer against bogus claims or exaggerated claims being made on products. So it's a claims-based process. We have a totally independent academic panel who actually sit and look at a portfolio of evidence on the product to justify the marketing claims that are being made. And we've all seen in the past the sort of really bizarre claims that have been made for some products. You know, 7 shades whiter in a week for a whitening toothpaste, which clearly is not supportable by any form of scientific research. So one of the things that we aim to do with the campaign is really make sure that the public can be reassured when they see the foundation accreditation logo on a pack, that the claims are justified and that they're not being sold over exaggerated claims and a product that doesn't work and doesn't say what it doesn't do what it says it does.
Sure. Thank you for the clarification there. And Nigel, in terms of motivation, how can we drive greater work outside of a practice setting for improved oral health?
I think this is going to be key to the future. I think we have a unique opportunity here with the pause that we've had to practice. We've spoken slightly earlier on about the move to remote consultations. I think these are going to change. This is going to give us greater access to patients, perhaps in between appointments, to be reinforcing remotely their oral hygiene and oral health regimes. We're currently looking at trying to launch a campaign to encourage dentists to take this time where they have no output related requirements. Uniquely in the history of the NHS, during this period, dentists are not being paid to drill and fill. So they have a unique opportunity to step back from their normal practice and move towards a preventive model, which we all know is the future, but which the system has been constrained against us delivering. So I think we have a real opportunity out of this crisis to really move things forward, put prevention centre in the agenda, both for the public on the outside, because they know they've got challenges in getting through to dental practices, and for the practitioners themselves to change towards a preventive and outcomes related model rather than the output related model that they've had in the past.
Yeah, I couldn't agree more, Nigel. So thank you so much for answering my questions there. And now moving on to for Auntie Wong.